Starting lab 19, the digestive system here. We're beginning with the hard palate. So we'll switch over to this model, sagittal section through the head. And we have to begin right here, the bony separation between the nasal cavity and the oral cavity. It's the hard palate region. The soft palate is now the area posterior to that. And that continues on, of course, to the tip of the soft palate, the uvula. We can see, of course, the area of the tongue and the structure inferior to the tongue, holding it to the floor of the oral cavity, the area of that lingual frenulum. There at the base of the tongue. We have the spacing now in the throat, specifically the oropharynx, and then moving inferiorly into the area of the laryngopharynx. In the mouth, we have the teeth, and we'll start to go through the detail of a single tooth. So the crown is the superficial exposed portion, whereas the root is found deeper in the bone. There's the root. The deeper portion of the tooth in the crown and in the area of the root is the area of the dentin, whereas the cementum is the superficial layering of the root. Is that cementum? And the enamel, we see the superficial layering just on the crown. Here in white is the enamel. The spacing within now, the pulp cavity, and leading deeper in, the opening at the end, the apical foramen, and the spacing between, right in here, is the area of the root canal. So switching over now from the detail of a tooth to seeing, of course, now all of the teeth, and we're looking at the adult set here. So we can start with the incisors, and we'll just do half of the jaw. So we can start here with the incisor, and we see the pair here for incisors. And then we have the next tooth over, the cuspid. The next two are premolars, and we have the remaining 1, 2, and 3 that we see here as the molars. And the same goes for the inferior row. So there's incisors, cuspid, there's now the premolars, and then 1, 2, and 3 molars. And it's at the base of the teeth, we'll go back here to see the gingiva, the gum tissue. So now let's move on to the digestive tract. Spanning down from that area of the pharynx that we pointed out earlier, we then lead down to the esophagus, and we can see this wide view, the stomach, and now all of the intestines. But we'll go in for a detailed look first here on the stomach. And we see that connection from the esophagus to the stomach. And now let's begin by zooming in here. So the internal folds inside of the stomach, these ridges are the rugae. The cardia, this is the point where the esophagus and the stomach connect. So right here, that area of the cardia. The fundus is now the superior bulging area here of the stomach. The body is the majority of the organ. All this midsection is the body. And then the final portion of the stomach here is the pylorus. Inside of the pylorus, we see the valve here is the pyloric sphincter. And the different sides of the organs, the medial side that's shorter, this is the lesser curvature. And the opposite side, the lateral side that's longer, that is the greater curvature for the stomach. Moving beyond the stomach, We can now see a view of the small intestines here in tan specifically. And the plica, we see the ridges and folds inside of here. And this first section of the small intestines, this curved portion here, this is the duodenum. Then we go on to the area of the jejunum. And then we see it's kind of divided like so. This more inferior area, this is the ileum. And at the distal end of the ileum, we can see here, it's known as a ileocecal valve. And that leads us in, of course, now to the large intestines. Large intestines seen here in gray and white. So just distal to the ileum, ileocecal valve. The proximal part of the large intestines right here is cecum, with the appendix hanging off of it. The term haustra, or any of these bulging segments, so multiple haustra across the large intestines. And the tinea coli is seen here as this white line running the length of the colon. So starting from the cecum, the portion now extending up the right side of the body. This is known as the ascending colon. And then coming across is a transverse colon. And then dropping down the left side of the body, there's now the descending colon. And it's from this point here, we'll highlight the area where it curves. It's the sigmoid colon, leading on to the area of the rectum, with the anus being the canal at the end, the opening. So now moving into the next page of the lab, we have the tunics of the intestines. I'm going to start with the four major tunics. We have the tunica mucosa. The next major layer, the tunica submucosa. And then we have here on this view, the tunica muscularis. And our serosa, it would be just beyond the view here, but there's no detail to point out. So going back to the tunica mucosa for details, in pink, these are the epithelial cells at the absolute surface there. The lamina propria appears as any of this gray region. So right from here to here is that span of the lamina propria. And then just deep to it, we have this thin layer in pink that's known as the muscularis mucosae. So we notice that the lamina propria is between the epithelial tissue and the muscularis mucosae. And within this area here in green specifically, all of this green structure is the lacteal. And that's the details of the tunica mucosa. For the tunica submucosa, we're just pointing out here in yellow, these nerves represent that submucosal plexus. Again, within the tunica submucosa. The tunica muscularis, we now have the distinct layers of muscle tissue. So here we have what's known as inner circular muscle. And then we can see the next layer. This is the outer longitudinal muscle. And in between them in yellow is where we see the nerves of the myenteric plexus and features of the tunica muscularis. And again, anything beyond this outer longitudinal muscle would just be the very thin, delicate tunica serosa. Moving on to the accessory structures for the digestive system. So we see this poster view here of the oral cavity and the areas surrounding it. And we can see specifically here, this is the area of the parotid salivary gland. There's now lower down the submandibular salivary gland, and you notice a cut out of the mandible there. And then right here, it would be inferior to the tongue, the area of the sublingual salivary gland. We have this view here of internal organs, and starting here, we're able to see the area of the pancreas with the pancreatic duct running through it. We have a small section of liver, and we'll have a more complete model coming up, but a small section of liver, and we can see the gallbladder, and connected to the gallbladder, there's a cystic duct. And coming from the liver itself, we have what's called a common hepatic duct. And where these two merge now, that's a common bile duct. We also have a small section here of the small intestines, specifically the duodenum. And inside of the duodenum, the ridges here are the plica. And moving on to the liver itself. So that's this large model here, just showing a liver. And viewing the different details. We see in red, we're seeing the hepatic artery. And in blue, not the very big branch, but the smaller blue branches, that's where we're seeing the hepatic vein. And now it's the purple color. This is signifying hepatic portal vein. So a second vein, hepatic portal vein here in purple. We have the gallbladder and its ducts once more. So here's the gallbladder. And connected to the gallbladder is the cystic duct. Directly connected to the gallbladder is the cystic duct. We can see here from the other side, that's known as the common hepatic duct. And where these two merge and right where it's cut off, that would be the common bile duct. Seen once more. On the liver, we'll point out the lobes of the liver, of which there's 4. So on the right side, and the way to recognize the right side, the larger side of the liver, a larger right side is the right lobe, making the opposite of that, the left lobe. You want to view the gallbladder as a reference, and the area right next to the gallbladder, this is quadrate lobe. We'll put a Q, quadrate lobe. And here we're seeing this large blood vessel, actually the inferior vena cava. And the area next to that is a caudate lobe with a C. And just another view for the liver. So again, you can see how the right lobe is much, much bigger, and the left lobe is smaller. And now moving on to the posters. So we have a closer view here, the liver, duodenum, and pancreas, just as it says here. We'll zoom in. Earlier, we already pointed out salivary glands here. And then we'll take a closer look at the ileum and the cecum in this region, as well as just the general abdominal view. So we can see, of course, the liver, gallbladder, cystic duct, common hepatic duct, common bile duct. You see the details of the stomach, lesser curvature, greater curvature, fundus, pylorus with the internal pyloric sphincter, rugae, the folds inside, leading us to the duodenum. And again, now it's kind of stretched out with the general position of the jejunum going down to the ileum. Specifically from the ileum here, the ileocecal valve leading into the space of the cecum, and hanging off from the cecum, the appendix. Here's a closer look at the liver with its various blood vessels. So in red, the hepatic artery. Again, the multiple blue branches, the hepatic vein. And in the purple color, in purple, hepatic portal vein. Closer look at the gallbladder with its cystic duct, branching, you notice, from within the liver. Coming together here is that common hepatic duct. And when the two merge, it's now the common bile duct that leads into the duodenum. And the pancreas with its pancreatic duct. And the pancreatic duct also leads right into the duodenum. So now moving on to the histology section for the lab. And we'll see samples of digestive tract as well as some accessory organs. So here we're starting with the esophagus sample. And we'll start with the tunics. So to begin here, this would be the inside surface of the esophagus, the lumen, just a hollow space within. So starting from the lumen, we could put the bracket right here. And this is the tunica mucosa. Getting to here now is the tunica submucosa. And then going all the way across to here is now the area of the tunica muscularis. And the tunica adventitia, in the case of the esophagus, the adventitia is just the absolute edge here. So now let's go back to some details. This is the esophagus sample, and the giveaway is right at the surface, that thicker dark layer, and that's the only time we're going to see this. The esophagus has stratified squamous epithelium right at the surface, and that's the only digestive slide that we'll view that has that trait. You will notice now directly deep to the epithelial tissue there is this lighter area. The term for it is lamina propria. It's not a slide on the term for the histology specifically, but it's helpful to recognize that. And now we see the darker layer. This specifically is the muscularis mucosae. So now that we have all three of these pointed out, all three of these sublayers together make the tunica mucosa. So we're starting with the epithelial tissue, the lamina propria, the muscularis mucosae, and together that makes the tunica mucosa. So now once we cross the muscularis mucosae, and you can see the difference in color, So now here's that area of the tunica submucosa. We can see again the transition, the appearance from here to here. So this is now all the tunica muscularis. We can see right here the two different specific sublayers of muscle, but all together, tunica muscularis. So anything beyond the tunica muscularis is going to belong to the fourth tunic, and in terms of the esophagus is called adventitia. So really just a closer look. This is still another esophagus sample, and we're able to see again the stratified squamous epithelium. We see the area of the lamina propria for reference, and then you can see the transition now to the muscularis mucosae. So making all of this section tunica mucosa. Now we get to the area of the tunica submucosa. And then once again, you can clearly see these two different layers of muscle tissue. So this is the tunica muscularis. And then anything at the edge, you can see kind of the faint fibers here. For the esophagus, the fourth layer is called adventitia. So as long as you know the order, epithelial tissue, lamina propria, muscularis mucosae make tunica mucosa. Then there's a submucosa, tunica muscularis, and then you have the fourth tunic at the edge. All the samples follow the same orientation, the same order of structures. So now moving on to the stomach. And the trait we could use to recognize the stomach are these big folds here. And these are called rugae. So the rugae are singular, just one ruga. It's the indication that large mound, we're looking at the stomach. So to go through now the details, we have the tunica mucosa. And we'll zoom in, but right at the surface is where we have simple columnar epithelium. The stomach has a rather prominent and thick lamina propria for reference, making this pink line here, the muscularis mucosae. All of that is tunica mucosa. So now we see even up into the ruga itself, all of this area, much lighter open area of the tunica submucosa. You see the transition here. And once again, there's the two distinct layers for the tunica muscularis. And now in this case, the very edge, we're looking at the stomach, the very edge, faint fibers you see here, that's the area of the tunica serosa. And that's the name of the fourth tunic now that we're in the area of the abdominal cavity. And just zooming in closer again so we can see the big mound of a ruga. Again, the epithelial tissue is simple layering, simple columnar epithelium. A prominent lamina propria to the stomach. Here we have the muscularis mucosae. These three make the tunica mucosa. You can see the open area of the submucosa extending even into a ruga. And then we see, of course, the area for the tunica muscularis, with the serosa being just right here at the edge. Still a closer view, we start to see the simple columnar epithelium lining the surface of the stomach. And again, a very prominent lamina propria leading down to the muscularis mucosae. So now moving on to the duodenum of the small intestines. And traits used to recognize the duodenum. First, we start to see these really slender spikes right at the surface, known as a villus. And also, we're looking here in the area of the submucosa, and we'll zoom in, of course, but we start to see a lot of glands. So these are to be enzyme-producing glands that are in the tunica submucosa. And those two traits are helpful to recognize the duodenum. So to begin, lining the surface of the villi, that's where we once again see simple columnar epithelium. There's now all of the area of the lamina propria. And then we can't see it here yet, but the thin line of the muscularis mucosae, making all of that tunica mucosa. We've already pointed out tunica submucosa, and it transitions again in appearance and tissue, the tunica muscularis. And there's the absolute edge there, once again, is a serosa. So zooming in, we can see the spikes of the villi lined in the epithelial tissue, the span of the lamina propria for reference. And now here you can start to see the pink lining of the muscularis mucosae. Getting into the tunica submucosa. And again, for reference, we start to see the glands that are now found throughout the submucosa. And then getting on to the area of the tunica muscularis, with the serosa, of course, being just the remnants at the edge. And here we are zoomed in much closer to get a look at the epithelial tissue. So for the duodenum, simple columnar epithelium lining the surface of, you notice right here is one villus lined with simple columnar epithelium. And an even closer look. So now let's move over to the colon. That's the view that we have here. And once again, starting with the tunics, right at the surface, there's the tunica mucosa. You see the tunica submucosa. And a unique trait for the colon is the appearance of the tunica muscularis. Specifically, this superficial layer of muscle. So you notice it looks like it has these vertical strips. That unique appearance to the, specifically it's called circular muscle here on the sample. This is another unique trait to help you recognize the colon. So going to the details for the colon, starting at the tunica mucosa, another trait to recognize are these just very, very common, it just appears as white bubbles. These are known as goblet cells. And these white bubbles here, these goblet cells, if we go back, a little difficult to see, but they're extremely common in the tunica mucosa of the colon. That could be another helpful tip. So again, the epithelial tissue here in pink is where we're seeing, once again, simple columnar epithelial tissue. Scattered between them are the numerous goblet cells, a trait of the colon especially. They're very common. And then there's, once again, the area of the lamina propria. And you can see the dark line right here. That would once again be the muscularis mucosae. Once we cross that, we always end up in the tunica submucosa. And another trait of the colon, the very unique appearance to the superficial layer of the muscularis, to that tunica muscularis. So now to finish up, we have a few more samples. We have, first of all, the liver histology. And to view the liver, here we're zoomed in close already. And we can see this area in here known as a central vein. And connected to the central vein, where you see any of these white canals, so the white spaces, so these tiny little white crevices, they're known as a sinusoid, a type of capillary, if you remember, a sinusoidal capillary, located here in the liver. And the name for liver cells, so you notice there's the row of pink cells, pink cytoplasm with the purple stain to the nucleus. The name of the cells that line the sinusoids are the hepatic plates, the rows of cells. One liver cell is known as an hepatocyte, and the column of hepatocytes are known as hepatic plates. And these hepatic plates line the sinusoidal capillaries. And we see all of these sinusoidal capillaries from all around leading into that central vein. Just a closer look now, of course, the central vein. So we start to see a sinusoid leading into here. And again, the liver cells organized in a column are known as hepatic plates. And the final sample, the pancreas. So it was last time in the endocrine section, we viewed this area here, the lighter stained cytoplasm, as one portion of the pancreas. But now we're focused on the darker surrounding majority. So it's out here, and you can see the darker staining to the cytoplasm. These areas are known as the pancreatic acini. And of course, you see this all around the majority of the tissue. So all surrounding this lighter stained region, we have a large majority of the pancreatic acini.